Welcome to our musculoskeletal nursing review. Let's begin with a crucial topic: preventing fractures in older adults. Falls are a leading cause of injury among seniors, and many of these accidents occur inside the home. One of the most effective ways to reduce fall risk is by wearing supportive, non-skid shoes that are comfortable for daily use. Unlike tacking down scatter rugs, which can still pose a hazard, eliminating them altogether is safer. While range of motion exercises are important, most daily activities already provide sufficient movement, so specialized instruction isn't always necessary. Remember, falls often happen indoors, not just outside. By focusing on proper footwear and a safe home environment, we can help older adults maintain their independence and avoid unnecessary injuries. Now let's discuss the management of common musculoskeletal injuries such as sprains, fractures, and repetitive strain injuries. For repetitive strain, modifying arm movements and ergonomics is key. Surgery and injections are not first-line treatments. When it comes to a sprained ankle, elevating the limb above heart level using pillows helps reduce swelling and pain. Cold packs are recommended for the first 24 to 48 hours, while keeping the joint immobile prevents further injury. For fractures such as a non-displaced radius, a cast is typically required for at least 6 weeks to ensure proper healing. It's important to remember that swelling resolution does not mean the bone has healed. These evidence-based interventions promote optimal recovery and minimize complications. Mobility is a major concern for patients with musculoskeletal injuries. Teaching safe use of assistive devices like crutches is essential. For example, patients with non-weight-bearing restrictions should move the crutches and injured leg forward together, then advance the unaffected leg. Weight should be supported by the hands, not the axilla, to avoid nerve damage. Furniture should not be used for balance, as this increases fall risk. When using external fixation devices or casts, daily pin site care and monitoring for signs of infection are crucial. Additionally, patients recovering from hip or knee surgery must follow specific weight-bearing and movement instructions to prevent complications. Proper education and supervision during initial transfers or ambulation can make a significant difference in patient outcomes. Early recognition and prompt response to complications can be life-saving. For instance, severe pain unrelieved by medication, cool extremities, and faint pulses may indicate compartment syndrome, requiring immediate provider notification. Sudden shortness of breath and confusion after a fracture could signal a fat embolism or pulmonary embolism. Administering oxygen and monitoring saturation are top priorities. Monitoring for signs of infection, such as fever after open reduction and internal fixation, is also critical. Nurses must be vigilant for abnormal findings like slow capillary refill, numbness, or swelling, and report these promptly to prevent permanent damage. By staying alert and acting quickly, nurses play a vital role in safeguarding patient health during recovery. Managing chronic musculoskeletal conditions like osteoarthritis, rheumatoid arthritis, and osteoporosis requires comprehensive patient education. For osteoarthritis, encourage regular exercise, weight management, and appropriate use of medications like NSAIDs and capsaicin cream. Patients with rheumatoid arthritis benefit from rest during flare-ups, warm showers to relieve morning stiffness, and adherence to prescribed disease-modifying drugs. Osteoporosis management focuses on calcium intake, weight-bearing exercise, and safe medication administration, such as taking bisphosphonates while upright. Teaching patients about recognizing medication side effects, preventing joint contractures, and maintaining joint function is essential for long-term quality of life. Empowering patients with knowledge helps them actively participate in their care and make informed decisions.